So you found out that you have cancer and you're gonna be talking with your oncologist. What questions do you wanna ask? How are you gonna prepare? That's what I'm gonna talk to you about in this video. My name is Dr. Florence Wright. I am a board certified radiation oncologist. If you or someone you know has recently been diagnosed with cancer, you might be scared, you might not know where to start. I'm gonna help you with that. And while I am a doctor, I am not your doctor. So nothing I say here is to be construed as medical advice. If you have a question, you need to talk to your doctor about it. If you don't feel comfortable talking to your doctor about questions you have, you need to find a different doctor. So diving in, how to prepare for your visit with the oncologist, questions to ask when you visit the oncologist. So first off, it's gonna be super scary and super intimidating, and nothing that I'm gonna do here is gonna make that change. It is intimidating, so just go ahead and breathe into that, be present with that. There's not a lot to do about that except recognize that it is super duper normal. It's okay to be scared when something is scary. Off the bat, go ahead and forgive yourself in advance. Your doctor has seen it before. Your nurses have seen it before. Don't get embarrassed about anything that you do or don't do or think you're supposed to show up a certain way. However you show up is how you're supposed to show up. So one very important thing to know walking into your oncologist's office is what is important to you, because what's important to you may not be what's important to us or what's important to your friend, right? Everybody's very, very different. Maybe you want to know all the micro details about the side effects of the treatment you're going to get. Maybe the first time you go in, you are too scared to know anything about your prognosis, or maybe you want to know about your prognosis in detail. That's totally individual, totally personal, totally up to you. There are cultural differences too. There are some cultures where particularly kind of like older, more mature rather, members of the culture maybe don't want to know anything. They just want to show up and not know anything. They don't even want to know the diagnosis, okay? You're allowed to do those things. So whatever feels most comfortable and most right for you, that's what you should do. Next thing to do is write down all your questions beforehand. But write them down, one, so that you see what it is that you are interested in knowing, but mainly because you are going to forget them when you get in there with the big white coat and the big scary room and it smells like alcohol and hospital or whatever. I don't know what that smell is in the hospital, right? Like it's alcohol and something. Anyway, you're gonna forget all your questions. They're gonna fly out of your mind. And we as oncologists, we're gonna start talking about what we think is important, and that is not always the same thing that you think is important. So write your questions down because we really do wanna answer your questions. We want you to know what you want to know about this treatment, right? Because you need to make an informed decision. You need to know everything that's important to you to make sure that you're making the decision that is right for you. There's nothing wrong with you, by the way, that you're going to forget them. I forget questions when I go to the doctor because they start talking about some other thing and I'm like following them like a little rabbit. Like, oh, what's that? Okay, yeah, let's talk about that. But when I got here, I wanted to talk about these other things. And then as soon as the door closes, when the doctor leaves, you're like, crap, wait, I wanted to ask about XYZ. And I completely forgot because they were talking about ABC. It's okay to follow your doctor down those rabbit holes as long as you have a list of the stuff that you want to get answered to, right? Now, do not bring a list of 80 questions. Your doctor will not have time to answer 80 questions. So what you want to do is have 5 to 10 very important questions you want to make sure you get answered. If you really can't, then schedule a follow-up appointment with your doctor afterwards. It might not be later that day or the next day, but it shouldn't be a big deal to schedule a follow-up appointment with your doctor so that they can answer your questions. Like I said at the beginning, if you don't feel comfortable asking your doctor questions, you really should find a different doctor. Sometimes patients ask me questions and I'm like, oh my gosh, this is so obvious. I can't believe they asked that. And then I remember they didn't go to medical school. Even if the question seems super obvious to me, that doesn't mean it's super obvious to you, and I don't want to ever make you feel stupid for asking a question. You need to ask all the questions that you have. You need to get your questions answered, and if your doctor is making you feel stupid for asking a question, I don't think that's okay. You need to feel comfortable asking your doctor questions. You're going to have a lot of questions. You're supposed to have a lot of questions. Although, when you get there, the first time you see them, and they're like, what questions do you have? It is super common for your mind to go blank. So that's the point of this, and that's why you write it all down before you go. Oh, the other really important thing is you write all this stuff down, bring it with you, okay? So if you write it down and then you leave it at home, it's not gonna help you. And then write down the answers too. And you can ask your doctor to pause and like, wait a minute, let me write that down. Or have your friend writing down the answers and then take that with you too, because you're gonna forget the answers, okay? You're gonna forget the questions before you cut if you don't bring them with you, and you're gonna forget the answers if you don't write them down. So pens and ink, man. Because most of the time doctors don't want to be recorded. That's the other thing. I really don't mind if people take notes, but most doctors are not going to want to be recorded. You do need to ask your doctor if it's okay for you to record the session. Sometimes I will. It's not like the end of the world. Another great tip that I recommend to everybody is bring an extra set of ears, ideally attached to an extra brain, with you. You're not going to hear half of what we say. Okay? Like I said, it's not like you're sitting down prepared for a lecture. Your brain is like on crazy energy, fight or flight mode because it's a scary situation. You're not like designed for learning in that situation. Bring someone who loves you, who's gonna take notes, who's not gonna be like doodling and like zoned out, or you have that friend that like they really wanna be involved, but also they're not that helpful, maybe. That's not who you wanna bring, okay? Don't worry about hurting anybody's feelings, all right? Screw everybody else's feelings. This is your life. This is your health. Bring who you think is gonna be the most useful to you. Sometimes people that really, really wanna be there for you, you end up like taking care of them. Don't bring that person, okay? Bring the person who's gonna be there to support you. If it's between bringing no one and bringing that person, bring someone, okay? It's always better to have an extra set of ears. The other thing is if you can't bring somebody with you, you can have them on the phone. Like if there's somebody that really wanted to come with you and they couldn't be there because it's COVID or they live in another part of the country or the world, you can ask if it's okay for you to call them and you can just speakerphone them, and I do that all the time too. And that counts as an extra set of ears and an extra brain, and they can take notes for you too. So that's a really good way around if there's somebody that you think is a good person to have there with you, but they can't physically be there with you. You can always phone a friend. If there is a language barrier and you don't speak the same language as your doctor, I generally recommend against having your family member as a translator. Okay, when you bring a family member or a support person or a friend, you want them there as your support person or your friend. The doctor's office will have a translation line usually. There's like a speakerphone that they can get an interpreter on the line for, and I generally recommend that if it's available so that other person is not working. They're just there present as your caregiver. Other questions to ask, how much support are you going to need? Some cancer treatments, you can keep working. You don't have to tell anybody. Nobody's gonna know if you don't tell them. Sometimes you're gonna need to go on disability. So ask your doctor how much they expect this to impact your everyday life. How much support are you gonna need? Do you need to hire a nurse? Are you gonna need to get disability paperwork filled out? Where do you get the disability paperwork filled out? Will they fill it out for you? If you live alone, are you gonna need somebody living with you during all or part of this treatment because of side effects and things like that? So those are things that you wanna ask early on so that you can prepare for them. Another thing is do you need referrals to a dietitian? A physical therapist? What sort of recovery do they expect from the kind of treatments that you're having? How long from point A to I'm back to where I started or as close as I'm gonna be to where I started? Because maybe your treatment course is only a month, but there's gonna be 3 months of recovery afterwards, right? So those are the kind of questions you wanna ask. This is not for everybody, although I do kind of recommend it, but not everybody takes me up on it, which is support groups. One thing about cancer is that everybody knows someone who's had it. Lots and lots of people have gone through whatever you're going through or your loved one is going through. You are not alone, but it can feel like you're alone, and it can feel like you're the very first person that's ever gone through this and nobody can understand what I'm going through, and very, very isolating. People can understand what you're going through. Someone else has gone through it, probably somebody in your neighborhood. So I think support groups are a great idea. They create a community and they let you understand that you are not alone in whatever side effect you're having, whatever feelings you're having. Other people have gone through it too, and they're there to support you and you're there to support them. Another thing is therapy. So our little tiny human brains, which are actually pretty big, they are not designed for this kind of crap, right? We are designed for day-to-day, forage for food, make sure that we're clean enough to not have bugs on us, sleep when we're supposed to. When we have these big external traumas, this is why we live in communities, right? So you are going to need support. Emotional support, psychological support, maybe even physical support at times. You need other people to lean on. Your brain is gonna have moments where it's not working right. So a therapist is somebody that you can lean on in those situations. It's great if you can find a therapist who works specifically with cancer patients, but any therapist in a pinch will do. I have a lot of patients that tell me, oh, I have a friend so-and-so, and she's really great at listening to me. And that's great, that is wonderful. Still consider talking to a therapist. You want somebody who kind of knows the terrain to be your guide through it. You want to ask your doctor if there's any special supplies you can stock up on. If you're going to have a bunch of skin reaction, for example, are there creams that you should be buying in advance? If they expect that you're going to need pain medication, I always try to give my patients their pain medication prescriptions at least a week before I expect they're going to need it. Because let's say that you have a really painful sore on your butt, you don't want to be standing in line at Walgreens waiting for a prescription and then being told that it's back ordered while you're in pain, right? You want to have that at home before you need it so that you're not waiting for it when you do. Depending on the location of your tumor and the side effects that I expect from the treatment, I will give people like a shopping list. Anytime you go to the doctor, they're going to tell you all the stuff that they think is important, and at the end they're going to say, what questions do you have? And the two questions that you always need to make sure you get answered are, what are the next steps? And what is the timeline for those next steps? You want to know what's next and when to expect that next thing. That way, if it hasn't happened, you call the office, because papers fall off people's desks. Like, this is all run by humans, right? Sometimes, phone calls go unreturned, or people miss, computers get glitches and something that was scheduled disappears. So you have to be really kind of on top of this, right? I want you to be your strongest advocate. You have to show up more than anybody else does. And don't worry about pissing people off, honestly. This is the time to be the squeaky wheel. You need to get all the oil. The main thing is, before you leave, make sure that you understand what the next step is in your care, what we are waiting for before that next step takes place. Is the next step that you start chemo? Okay, what happens before you start chemo? Okay, they have to put a port in you. When is that going to be scheduled? Oh, you have to see another doctor before you get the port put in. When is that appointment going to be scheduled? So you want to know the timeline. You want to know, this is what we're doing next, these are the steps we're taking before that next thing, and this is when we expect those things to be done by. Keeping that in mind, you don't want to go too far down those roads, because this is an element of choose your own adventure, right? There's a lot of little break points, right? If you think of a branch, and then there's a connection point, and then that one goes off this way and that way, and then this one goes off this way and that way, and there's like a million different ways it can go, right? So there's a lot of decision points along the way where things can change. So your doctor may not be able to answer where you're going to be in 6 months because they don't have all the information yet. There's going to be a lot of what ifs along the way, and you don't want to think about a what if that's 6 decisions down the line when you may end up going the other way, and then you're just worrying about all this stuff that you never even have to worry about because that's not actually what's happening for you. That's a really hard thing to do. So I'm saying it like, yes, don't worry about all the what ifs. Super duper easy. It sounds simple, but it's hard, right? Because what if? What if this happens? What if that happens? But you're gonna have plenty of not what if. This is what happened that you have to worry about, okay? So save your brain space to worry about what actually happens. Another question to ask, there's lots of different types of treatments for cancer. There's surgery, there's radiation, there's chemo, there's immunotherapy. You wanna know why your doctor is recommending this treatment. What other options are available to treat this cancer? I mean, I assume that your doctor is recommending the treatment that they think is the best for you, right? Like, otherwise, if there was something else they thought would be better for you, they would recommend that. But it is a good idea to know what the alternatives are and what the risks are. So the things that you want to know are, what is the treatment they're recommending? What's the name of it? So you can go look it up online. Why they're recommending that over other things? What are the risks of not doing this treatment? Like, what do you expect to happen if I don't get this treatment? What are the benefits of doing this treatment? What benefits do you expect me to have from doing the treatment you recommend? And then what are the alternatives to doing this treatment? And why don't you recommend those alternatives? Why do you think this one's the best one for me? So it's RBA, risks, benefits, alternatives, which is that a baseball thing? That's RBI. I feel like RBA is a thing too, but maybe not baseball, I think. Anyway, I'm super sporty. I know about sports. You also want to ask if there are any clinical trials that you might qualify for. People sometimes shy away from clinical trials, and there are some very good cultural reasons why certain communities in the United States in particular have a deep distrust for the medical community, and it's well earned. But clinical trials are a super duper important part of advancing medical care in the US and in the world. And they're also one of the ways to get the most cutting edge type of treatment for whatever cancer you have. So it's always important to ask if it's something that you're interested in, if you qualify for any open clinical trials. And this can be things all the way from different types of surgery, newfangled chemotherapy, new forms of immunotherapy, different types of radiation therapy combined with any of the above treatments, all the way to like cancer vaccines and different super newfangled therapy that doesn't even have a name. It's just got like letters and numbers. So ask if there are any clinical trials that are open that you would qualify for, that they think you might be a good candidate for. And then one of the other most important questions to ask and topics to discuss with your oncologist that is very challenging for some people and even challenging for some doctors to talk about, honestly, but I think is probably one of the most important things to understand when you leave the office is, what is the goal of this treatment? Is the goal so that I never have to worry about this cancer ever again and that I'm done with it? Is the goal to kick the can down the road 6 months until it comes back and we have to worry about it again and do something else? Is the goal just to treat this pain and it's not going to make me live any longer, but it's going to make me more comfortable? Is the goal to prevent me from having some really bad side effect and it's not going to make me feel better right now and it's not going to make me live longer, but it's going to keep me from having a seizure, or it's going to make it so that I don't lose the ability to walk? So you want to know, I don't want you to walk out of the office thinking that this is a treatment that's going to make you live 10 years longer when really it's just going to treat your pain. So that's something that is kind of hard to sometimes glean from the way we talk to you, but it's a really important thing for you to understand. And that's a question you have to ask repeatedly, because the goals of your treatment may change over time. So it may be that we are aiming to knock this out of the park so that it never ever comes back, and that's the goal of treatment when we start. And unfortunately, you are one of the subset of patients that this treatment didn't work amazingly well and your tumor spread or it came back. The goal the next time around may not be to knock it out of the park again. The goal may be to kick it down the road 5 or 10 years, knowing that there's a good chance it's going to come back. Or the goal may be to treat your pain because you're in such terrible pain and maybe this treatment won't make you live longer, or maybe it'll only make you live a little bit longer. So it's an important question to have in your pocket that you need to get answered probably, hopefully only one time, but potentially more than once. So in summation, important questions, things you want to have ready. What's important to you? Decide that ahead of time, have that in your mind. Write it down. Write down your questions ahead of time. Write down the answers that you get to those questions while you're there in clinic. Bring an extra set of ears, either physically with you to take notes or over the phone. Ask how much support you're going to need and when you might need it. That way you can do things, you can schedule things in advance. What special supplies might you want to gather before you start your treatment? Before you leave, make sure you understand what are the next steps, what are we waiting for before we get those next steps taken care of, and what is the timeline? Is this something that's going to take 2 weeks? Is this something that's going to take 6 months? Are you going to be doing this for a year? And you want to know that as you're leaving the clinic. And RBA, risk benefit alternatives to the treatments that they're recommending for you. And very importantly, what is the goal of the treatment that you're recommending? I hope this is helpful to you. If you got something out of this, go ahead and click subscribe and check out some of the other videos, and I'll see you next time.